So it's all yours, Helen.
Okay, great. Thank you, Gary, and thank you, Cheryl, for the introduction. And it's so good to see so many of you this morning. My name is Helen King, and I have the very distinct privilege of serving as your Agency on Aging Director. And we'll talk about the agencies on aging before we get into the Community Engagement Forum because they are directly tied. A little bit about myself before I get into the presentation. Social work is a second career for me. I actually spent over 20 years doing IT project management, and I can honestly say I hated every single year of it. I would go into meetings and it'd be like I was on the Peanuts show, where they were all talking wah, 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 it's like just not interesting. So did a lot of soul searching, a lot of talking to people, and someone suggested social work, and it was like a light bulb went off. And so back in 2013, I took a leap of faith and I went back to school and got my Master of Social Work from Catholic University. After graduating, I spent about a year doing direct service in DC. I was a social worker for Terrific Incorporated in Ward 2. I absolutely loved the job. I got to meet some amazing people, and I could walk to all of my clients. All right, I would take the metro in and I would walk all day, and it was really a great little job. But I knew that my heart really was not in doing direct service every day, but in doing more policy and advocacy and this type of macro work. So an opportunity opened up in Arlington that I jumped on because it was a foot in the door. I spent about 2 years coordinating the volunteer guardianship program here. And then I think it was 2018, I moved into the Agency on Aging, first as the management analyst, and then moved into the role of the director when that became open. So I have been in this role now for 3 years. I absolutely love it. I love the people that I get to meet and work with. I have responsibility for staffing the Commission on Aging, which is an amazing group of advocates who helps me do the work that I do. And I also, like I said, get to do fun things like this and talk to the great individuals in Arlington that we serve. So I'm going to go ahead and share my screen. I have a few slides, but I'm hoping, we can get through those and then have it more of an interactive conversation about the Agency on Aging and how we use events like the Community Engagement Forum to inform our work. Okay, so I'm going to go ahead and share. And Gary, if you can let me know that you can see I'm going to start the slideshow and then let me know it still looks good.
Yep, looks good.
All right, great. So, all right. So first of all, we all know that the percentage of older adults in our country is increasing. It is projected that by 2034, the percentage of the population that is 65 and older will exceed the percentage of those under 18 for the first time in history. So this is not new information, but this is definitely something that, we use in a lot of our advocacy especially for talking about making sure that we are doing appropriate programming for the adults 65 and older, because there's a lot of attention that gets paid to younger people, especially the children under 18. So area agencies on aging have a mission to maintain the maximum independence and dignity of older people by providing supportive services and allowing people to age in place in the community of their choice for as long as it's safely possible for them to do that. Area agencies on aging are across the country. Every community has one. They're actually mandated by the Older Americans Act. So you can see by this slide, there are 622 area agencies on aging across the country. In Virginia, there are 25. And then each of the counties up here in Northern Virginia has an agency on aging that is attached to the local government. They're not all called Agency on Aging. Some of them are called Office on Aging. Some of them are called Senior Services, but they all function with the same role of providing the planning, developing, coordinating, and delivery of services that are mandated, and most of them mandated by the Older Americans Act. To meet the needs and preferences of the older adults in our community. So again, we talked about the aging network, and I included this slide because it covers some of the core services that we're all required to provide. So services like nutrition services, caregiver services, health and wellness programming, elder rights, and other supportive services. We are mandated to provide services in these categories, but each community has the flexibility to provide them how they best meet the needs of the community. Okay. So in Arlington, and I will provide a copy of these slides if you have a way to distribute those to the participants, Gary, just so that you
Yes.
can have this information. So in Arlington, these are sort of the main categories that we provide under each one of those core service areas. So looking at elder rights, for example, we participate in the Northern Virginia Long-Term Care Ombudsman Program. That is a regional program. Fairfax, City of Alexandria, and Loudoun County also participate in the Northern Virginia Long-Term Care Ombudsman Program. And that's about ensuring that individuals who are in nursing homes or assisted living facilities have a voice, have an ability to resolve any issues maybe that they have with the administration or that type of thing. We do caregiver consultations. We provide some respite care for the caregivers. And our nutrition programs, those are mainly focused on the social 60+ cafes, which are our congregate meal programs at 3 of the 55+ centers. We do home delivered meals in partnership with Meals on Wheels of Arlington. We provide nutrition counseling and nutrition education. And we also participate in the Senior Farmers Market Nutrition Program, which is hot and heavy right now. I think our admin that processes the application is still buried about this high in applications on her desk for the Senior Farmers Market Program. In our health and wellness program, we do disease prevention and health promotion programming. These are all evidence-based programs to allow people to learn more and, successfully manage any health or disease issues, questions that they have. With supportive services, we have our Aging and Disability Resource Center, which is our front door into the aging and disability services in Arlington County. Our community living program is a sort of entry-level homemaker service. So things like light housekeeping, maybe laundry, maybe a little help with grocery shopping, sort of that first level of supports that somebody might need just to be able to stay in their homes. Senior Loops is a transportation program that we provide. There are 5 independent living residences for lower income older adults, and we provide a once a week transportation to places like Target or the grocery store just so that they can do their errands. We have connections to legal services, Northern Virginia Legal Services, and we also have a money management program. And then we are also allowed to provide other services that meet the needs of our community. So we have our Medicare counselors through our VICAP program, and we also have some attention paid to fraud, waste, and abuse in the Medicare system, and that's the Senior Medicare Patrol. Okay, this here, ties in closely to the statistics that I talked about before, where the population of older adults in America is projected to surpass those of children under 18. And so we know, and this is data that is gathered through the Weldon Cooper Center at the University of Virginia. In Virginia, many of the jurisdictions are already exceeding 20% of the population of older adults who are 60 and above. And there are several that it's actually more than 30%. And so the challenges that we're facing as agencies on aging and as communities, is how do we make sure that the appropriate amount of resources are focused on older adults? Okay. So this kind of ties into how do we as the agency on aging get information about what you, as as our constituents in Arlington, what's important to you, right? Where should I be focusing the efforts of the Agency on Aging? And one of the forums that we have to collect that information is our Community Engagement Forum on Aging Issues. We host this event once a year, usually in March. And the way that it has run for the last 8 or 9 years is that, we schedule it for pretty much an entire morning. We invite a keynote speaker to come in. We have others who come and speak. We'll pick a topic, and we have people come in and speak on relevant issues on that topic. And then once we have gotten through those presentations, we actually break up into smaller groups and have real conversations about, what are you experiencing with housing? What about transportation? So several different topic areas. And our goal is to hear from you what matters most, okay? So this past year, we held the event on Monday, March the 18th. And our theme this year was a roadmap to age-friendly Arlington. We picked this theme because this year was the year that we were developing our latest age-friendly plan, right? So we finished our first 5-year plan in 2023. And so developed what are our goals for the next 5 years towards forwarding Arlington to be an age-friendly community. And so we picked this theme because it tied in timing-wise perfectly with where we were in the plan. So the idea was to hear from everybody that attended, how can we make Arlington more age-friendly? What is really important in advancing the age-friendly status of Arlington? So we held the main event at Lover Run. We had a small little satellite group over at Culpeper Garden, and we also had virtual access available via Teams. So people could attend how they were comfortable. I was really happy to see that there were over 60 individuals attended in person this year, plus another 15 over at Culpeper Garden. It's probably the biggest in-person group that we've had since COVID started back in 2020. And so really excited to see individuals coming and engaging in person. A couple things that we did this year that were a little bit different. First one really was having a resource fair. And so we had some of our key partners available at Lover Run, just providing information and being available to talk to individuals both before and after the program. Our keynote speaker was Rodney Harrell from AARP, and he is a vice president of policy at AARP, and one of his focuses is on livability. So he gave a really excellent presentation. And then the breakout rooms, we had smaller groups in person. There was the one group at Culpeper. We had 3 groups at Lover Run, and then there was a breakout room in Teams for those that wanted to stay and participate and provide input. So we were able to collect a good amount of information. So when we do registration, we do ask people if it was their first time attending, how did they hear about the event, and what zip code were they in. About 74% of the people who attended this year said it was their first time attending, which I think is great. And we also had a lot more individuals this year who I would say, so some years we have had a lot of the advocates and the service providers, a bigger percentage of them versus the consumers, I guess is probably the best way to describe it. So this year I was really excited to see that we actually had more consumers in the room. And so it's always good to get the voices of a diverse group, right? So not just the advocates, but also those that are using the services. And then 22204 and 22201 were the most represented zip codes in the registrations. And email was how most people learned of the event. And then I just show the breakout here of how many people attended at the various locations. And so in the breakout rooms, we asked everybody the same 10 questions. And so what we like to do then is take a look at the responses that we get from the individuals. What do they like about Arlington? And then what are some of the challenges, or what are some ideas that came out of the room? So a couple of things that I'll point out here, as somebody mentioned that they called Arlington home for more than 50 years and they don't want to move. And then, so I can't see my own slide here. Let's see, housing as you age is not affordable in Arlington. I don't think that's a surprise to any of us. Somebody suggested maybe we work on a way to offer credits for volunteer work so that we can help offset property taxes. And then a comment about needing more options to age in the community, not just in the home. And then somebody pointed out that while we're diverse, we're still very segregated by age, race, and religion. So, and those were all in response to, you think Arlington is a good community for older adults? So the next question we asked is is related to housing, right? How do you feel about where you live? We were excited to see somebody suggested trying a neighborhood village model in a high rise, so that, we could better know the people who were living in the high rise with us and be able to exchange not only contact information with those individuals, but maybe somebody who could help me do a small chore or something like that. So thought that was a great idea. We need to do some more work on the accessibility of our community. And then, I think those were the main points out of housing. Just, again, no surprise, but somebody pointed out that it's not just expensive or unaffordable, but mind-blowingly expensive. So, the next group was about transportation. How do we travel around and outside of Arlington? And a lot of people use the public transportation, mixed reviews about Metro access. A lot of feedback that getting to and from the hospital is difficult, especially if you're using public transportation. And then safety issues, specifically around crosswalks and sidewalks. And so those are areas that we'll be looking into. We asked a question about equity, and specifically, to what extent do we think the county meets the needs of the diverse population of older adults? And I think that, people felt like at the micro level and the programs that I participate in, it's there, but in general, as a community, we're still very segregated. The next group is around health and wellness. What do you need to be healthy? We found out that people are having challenges finding providers who will accept Medicare and/or Medicaid. Also, if you're a solo ager, having somebody who can go with you to a medical procedure and then be able to transport you back home, which I think is a service that A&B provides to your members, but looking at how do we expand that really across the county. And then access to dental and ophthalmology services is also a challenge. Okay, looking at long-term care, right? How do you perceive the quality of nursing home and assisted livings in our community? And again, no surprise, it's just too expensive. And that for some of the quote unquote affordable facilities, there are long wait lists. People noted that it's difficult to find and understand the options that exist. And then long-term care is too institutionalized. And then we just provided here a summary of, so Genworth puts out an annual survey of the costs for long-term care. So comparing in-home care with home health aides versus a nursing home, a private room in a nursing home, and what that would cost per month. Okay. And all of it, when I look at it, really does feel like it's just unaffordable. All right, the next question of outreach: when you need information, where do you find it? And so a lot of people talked about, you know, Arlington County emails, the 55+ programs, their faith communities. Somebody mentioned the Aging Matters podcast, Cheryl. So they go there for their information, you know, and just really a lot of the community events. So, you know, we talked about some of the different opportunities that exist for outreach, and doing more listening sessions throughout the year instead of just this one in March, and targeting specific communities so we make sure we're hearing a broader selection of the voices. There is a need for more information about the ambassador program, and then somebody thought that, you know, we should utilize our partnership with Marymount, and the Center for Optimal Aging, as well as the health school that's there. They have, I think, a nursing school and some other things that maybe we could take advantage of. And then the final question we ask everybody is, if you had a magic wand, what is one thing you would change about Arlington for older adults? Affordable and accessible housing, more walkable routes, a source of information for locating resources, universal access to the internet, bus stops in front of every community center, transit routes that go directly to the hospital, the volunteers getting property tax credits, again, came up, shared housing, and maintaining taxes, or so keeping taxes more at a level rate. So these are the questions that we ask in the breakout sessions, and you know, just really listen to what responses we get from the individuals. So then we take all of that information and we put it in together to look at sort of what were the more common themes that we heard across, and kind of pick our top 5, what matters most. So first and foremost is housing. Second this year was transportation. Third is social connections. The fourth one is walkability. And then the fifth one is access to healthcare. Okay, and so I share all of this with you because it's great that we have all of this information, but then what do I do with it, right? So every year, and I don't have a slide specifically on this, but every year I have to report to the state what my plan is for spending the Older Americans Act money that is allocated to Arlington. And so it falls into the different categories that we talked about earlier. So those 5 core programs. And they ask me to describe in each of those 5 core programs, how am I going to spend the funds? And so, like I mentioned earlier, I have the flexibility. I'm contained in that I have to provide nutrition services, but I have the flexibility to provide the nutrition services that make the most sense for Arlington, for example. So, so how I learn how to spend that money is through these interactions, through these conversations, through, you know, the community engagement forum is our biggest source of information to provide input into that area plan. So I am currently working on the area plan for the federal fiscal year 2025, which will start October 1st. And I take this input and some of the feedback that we've received and make sure that I am doing the best that I can to address those most important needs, the what matters most. And so hopefully that makes sense. And I think that's probably, I'm going to stop sharing my screen at this point, because I think these are the, I think that's really the bulk of what I wanted to share this morning. And so certainly would take any questions at this point, and answer anything that I can.
Okay, we've got, somebody's asked, you've mentioned a number of services that are available to seniors. Yes. And they'd kind of like just a quick rundown of which ones are open to anybody and which ones are income-based.
So
Or-
most of the services that we offer through the Agency on Aging are for individuals who are 60 and older. Okay, so they are not income qualified, but we also have a mandate to ensure that we are prioritizing the highest need. So prioritizing low income and diverse populations. Okay. There are a couple of the programs that have a sliding scale on them. So for example, Meals on Wheels. We will ask that if your income is above a certain level that you pay the full price for the meals, but we're also through the Older Americans Act mandated that we never refuse to serve anybody for lack of ability to pay. Okay, so so there are what we call suggested contributions. If you are able to pay, great, and if not, you're not going to get it turned away from the service. Some of the other programs that we have, so like home delivered meals and our community living program, for example, those we have a sliding scale for those. But the bigger eligibility criteria for those is that you meet the definition of being homebound. Okay, so and homebound doesn't mean that you never leave your home. It just means that you can't easily move, you can't easily leave your home without support or assistance, right? So somebody who requires an aide to help them get to the doctor's appointment might be classified as homebound. So like for Meals on Wheels and something like that, and the community living program, the homebound is the requirement more than the income is the requirement. We might ask based on income for you to make a contribution, but we wouldn't refuse service because of that. So.
Okay. Do you think that when people say housing as you age in Arlington isn't affordable, do they mean because taxes keep going up or because there aren't enough retirement type communities?
So I think there's a couple different reasons people say that. So first of all, there are a large percentage of older adults in Arlington who are renters, especially the lower income individuals. And as you all know, the rents jump anywhere from, I don't know, 3 to 5% up to 20% per year, right? So the rent just every year escalates. Property taxes going up can make it unaffordable to be able to stay in your home. So those are the two big reasons I know that individuals talk about housing and being unaffordable. And there aren't a lot of options for individuals who want to downsize or want to stay in Arlington, but go to more of a retirement type 55 plus community or active older adult type community. There's just not any options really for that kind of housing. So I think the options are limited. And I was visiting an individual who was 88 just earlier this week, and she's in a garden style apartment, right, that doesn't have an elevator. She could really use, even though she's technically on the first floor, it's still up a flight of stairs to get in and out. And the safety access door from the outside doesn't work. And so she has to come downstairs to accept a package, or she has to come down those stairs to let somebody in, a visitor in. And so, there are challenges like that. That's not related to affordability. That's related to accessibility. But, I think there's equal challenges with accessibility for housing in Arlington too.
We have another comment about the condition of the sidewalks around here. Talking about, they're so uneven, gaps, construction blocking them or leaving debris all over the place. I certainly second that notion. It's, even for somebody who's able-bodied, walking on some of the brick sidewalks around here is really hazardous.
It is, and I have scars on my knees where I've been attacked by the sidewalks here in Arlington as well. So I can tell you the Commission on Aging's Transportation Committee is very focused on the sidewalks. They're connected to the Complete Streets project, as well as some of the other initiatives in Arlington. But they heard loud and clear about the sidewalk safety issue and are working. I think that's actually one of their age-friendly goals for the next 5 years is to improve the sidewalks. So there should, we do what we can, right? But hopefully there will be some attention paid to that over the next few years.
You have language services like Spanish or other languages?
So we are able to serve, we have access to a translation service called, we call it our language line, interpreters and translators. And so if an individual were to come in or even call to the Aging and Disability Services, if English is not their first language or they're not comfortable communicating in English, we will connect to an interpreter who speaks that language and work through the interpreter to provide the service. So yes, and I think last year when we looked at the numbers, we served individuals in over 24 distinct languages. It's been as high as 27 throughout the years. So yeah, we use the language line quite a bit.
Does the Agency on Aging also partner with other Arlington agencies on issues like elder abuse, kinship caregiving, other programs affecting older adults?
Yeah, absolutely. Absolutely. So the Agency on Aging is contained within the Department of Human Services in Arlington County. We're part of the Aging and Disability Services Division. So we do work closely with the adult services, adult protective services. We talked about the regional program that is the long-term care ombudsman program. So if it's an individual in one of our assisted livings or nursing homes, we have contact with the long-term care ombudsman and work closely with them. And then the other commissions that are related to issues, that we care about, the Disability Advisory Commission. We also work closely with the Transportation Commission, the Housing Commission. We have a lot of what we call liaisons to the different commissions. And so we'll attend their meetings and listen to what they're talking about and provide updates on what we care about and see how we can work together. So yes, there's quite a bit of collaboration.
On a related question, how closely do you coordinate with other agencies on aging in the area for things like, lobbying and policy making and things like that?
Sure. So there is a group called the Northern Virginia Aging Network. So do a little backpedal and a little history. When the agencies on aging first were formed in Virginia, all 5 Northern Virginia jurisdictions were one agency on aging. And this goes way back to, I think, the 70s. So a little bit before my time coming to Arlington. But at some point, a decision was made to split the group apart so that each county has its own agency on aging. But because we are attached to local government, we as the Agency on Aging employees aren't able to do any advocating or, that type of work directly. Okay. So the Northern Virginia Aging Network was formed to allow the agencies on aging and the commissions on aging to all get together. We meet every other month and talk about, important issues for aging. But we also come up with a platform that we then goes out and advocates for with our local delegations. So at the state level. And so, this past year, for example, one of the items that we advocated for was increasing the availability of virtual participation in public meetings from 25% to 50%, right? And actually that legislation was passed through. We've advocated for things like nursing home staffing levels, a minimum staffing level at a nursing home. We've advocated for some of the eviction prevention policies to, to increase the amount of time that people have to respond to notification that they're delinquent on their rent or something like that, so that they've got a little bit more breathing space to be able to remedy the situation and not get evicted. And those are just some of the paid sick days for caregivers is another policy issue that NVAN has advocated for in the past. Increasing the number of affordable assisted living rooms in assisted living facilities, just to make it accessible to more individuals. And so those are just some of the things that NVAN advocates for, but we use our Commission on Aging and we use NVAN to really achieve the advocacy that we're not directly able to do as county government employees.
And we've got a couple of additional comments on sidewalks. You can see this is
Yes,
definitely a hot button issue.
Yep.
Somebody complaining about scooters being left on the sidewalks and how when they fall over, they can become a tripping hazard or you have to step out into the street to get around them.
I concur. And it's interesting, that was really a hot topic in the Commission on Aging, especially before COVID. And then COVID came and they kind of disappeared and it kind of died down, but it seems like, the scooters are really starting to come back again and be a bit of a nuisance. So definitely something that we're watching and I'll take that feedback back to the Transportation Committee.
They go on to say that in their neighborhood, they have ground down some of the uneven spots on the sidewalks,
Oh, wow.
which I'm seeing more and more around where I live. But they also pointed out that a lot of their neighborhood doesn't even have sidewalks.
Mm-hmm.
And
so there's the Complete Streets project that Arlington has, and I'd have to look it up on the website, but there is a Complete Streets project that is focused on ensuring that there's at least a sidewalk on the one side of the street in every neighborhood, I believe, is their focus. So I think that you can put in recommendations for streets that could use a sidewalk, and they'll put it into the mix for consideration for the next Complete Streets projects. So that's one avenue. And then I know there is an online problem reporting tool, so if there is a particularly nuisance, and I would even encourage you to do this with the scooters too, but a nuisance gap in the sidewalk or unevenness or whatever, right? You can report that through the county's problem reporting tool. And I don't know how quickly they respond to it, but they're supposed to respond to those and come out with, and hopefully fix it, at least assess it, if not fix it.
and I guess that addresses the next comment, which is talking about something that could be done immediately is better policing the trash and debris and fallen branches and stuff like that end up on the sidewalks. That shouldn't take 5 years to get a little more action on that.
Yeah, I think the biggest challenge, and I think it exists across the county, right, is resources. I know, the police department, and it's not really an excuse, but it is kind of reality, right? We're all short-staffed, we're all underfunded. And so, tools like the county's reporting, the problem reporting tool will help get the resources directed to that issue instead of them having to kind of drive around and see where the issues exist. So definitely encourage you to take advantage of that.
Yeah, so it sounds like that's the thing to do when people find stuff blocking the sidewalks is report that as a problem. Okay, next one is, I know that there are some senior housing options in Arlington for lower income residents, but are there any initiatives to develop more senior housing for other income levels? I've noticed that most new housing that goes up is either apartment buildings or very large houses. And it would be nice to see more smaller condos or even, retrofitting of empty office buildings.
Right, right. So I'm not aware of anything specific right now, but we also do work closely with our partners in community planning, housing, and development. Any chance that we get to beat the drum for older adults, we take it. And so I can certainly raise this the next time we meet with them and see what, if any, plans they have.
Next comment is that they know of a few states that provide some tax credits for volunteer work by seniors. Every dollar helps, and it helps the community by saving, not having to pay people to do these jobs. So
So whoever put that comment in, if you could give me an example of a state that has this program, that's helpful for me in doing my research and pushing that forward. So if you could just maybe drop in the chat which states you're referring to, that would help me, tremendously.
Okay, and the next question, is there anything new with the upcoming age-friendly Arlington plan?
So we did a little bit of so I think we reorganized it a little bit. I think that there was a new committee formed, a health and wellness, to really focus in on issues of health equity, of options for wellness programming, that type of thing. So there's a little bit in there. And then there was another new committee formed on aging, equity, and engagement. So I think one area that we will focus in on, again, is, socialization and engaging older adults in the community more. How do we go about doing that? There's also a concerted effort on education about scams and that type of scams and fraud and that type of thing. So I think you'll see more of that in the next year, especially they've done one program. I know there's another one being planned. Those are the top three that come to my mind. I haven't fully absorbed the new plan. It was just submitted this month to AARP. So, but would encourage anybody who's interested in being involved to get involved on the Commission on Aging. I will say you don't have to be a commissioner to be involved in the Commission on Aging. There are 5 different committees, and transportation is one of them, health and wellness. There's a legislative committee that focuses in on the advocacy. There's the new aging equity and engagement committee. And I'm missing one. Housing and supportive services. How could I forget that one? And they are really focused in on the the affordability of housing in Arlington and doing a little bit of work with the assisted living too. So the Commission on Aging webpage has a calendar of events. You can see some of the upcoming meetings that are, so each of the committees posts when their next meeting is. You can get attached to the you can connect to it either by attending in person or via Teams. Most of them are hybrid meetings or all virtual meetings. And and then if you're interested in being a commissioner on the Commission on Aging, we do have one vacancy right now. You would apply. The application itself is located on the Commission on Aging website, and it's just a short little application, and we'll talk to you about what the roles and responsibilities are. And then if you're still interested in moving forward, we'll recommend that to the county board, and it's the county board that appoints the commissioners.
Okay. Comment here that they recently gone on a 55+ trip and noticed that the prices are continuing to go up. Is this just due to inflation, or is there a new contract that's causing the prices to rise?
So I don't know too much about how, so the Office of 55 Plus Programs falls within the Department of Parks and Recreation. And so I'm not as involved with their programming or their, how they're setting their pricing. I am sure that it's largely related to the cost of things going up. You know, transportation costs have skyrocketed over the last couple years. And, you know, we're all just really trying to catch our breath with when we see the numbers. So, you know, I would imagine that's what it is, but I will take that question back to my colleague in the Office of 55 Plus and see if I can get an answer.
Okay. Next comment is talking about the need for a new benefits enrollment center and volunteers to help people access benefits.
Yeah.
We need to pitch that as hard as we can.
Thanks, Wendy, for that cue. I am going to share my screen just really quickly one more time. Let's see, and hopefully this will work. Do you all see a slide that says Benefits Enrollment Center?
Yep.
Mhm.
Okay, perfect. So this year, Arlington was selected by the National Council on Aging to receive a Benefits Enrollment Center grant. And what that means is, you know, we will work with connecting older adults to some of those key programs that are out there and available. So things like, you know, we know that I think the number is 14 or 15% of older adults in Arlington live in poverty, but only 4% of them are connected to SNAP, which is the Supplemental Nutrition Assistance Program. So, you know, how do we get the word out? And then how do we help people apply for some of these key programs? There are low income subsidies to help pay the cost of your Medicare, not deductibles. What's the word? Sorry,
Co-pays,
lost it. Sorry,
co-pays.
not the copay. Your
Medicare savings programs.
no, I know that they're Medicaid servicing programs. It's your what's taken out of your Social Security every month to pay for the premium. Sorry, the premium. Sorry, there, I got it. I knew it would come. So there are programs for low-income individuals to help pay the premiums, you know, either supplement or even completely pay the premiums for Medicare. You know, low-income home energy assistance program for heating and cooling assistance, right? Your energy bills skyrocket in the summer and in the winter, and there are programs available for low-income individuals to help. So, so the benefits enrollment centers are all about, they have a tool called a benefits checkup. And so you can do this for yourself. You can do this on behalf of somebody else. Going in and entering a little bit of information, it will show you for your zip code what benefits you are might be eligible for. And then it will connect you to the applications for each of those. So our Aging and Disability Resource Center is now the Benefits Enrollment Center, but we need volunteers to help us to do community events, you know, or if you're in part of a group, you know, setting up a little a time or one of the agendas to be benefits enrollment checkups or that type of thing. So just really getting people involved to be in the community and helping connect people to the benefits that might ease their pocketbook just a little bit, right? If you've got $50 worth of SNAP, that's $50 less that you have to come up with out of your income to pay for groceries, for example. So we are looking for volunteers to help us. You know, we're still exploring the different ways, whether it's walk-in availability here at Department of Human Services, or, you know, we know that we're hoping to be able at the county fair, for example, to have a little side table where we can do benefits checkups with individuals and potentially help them get connected to these programs. So if you're interested, I think, you know, time commitment wise, it can be very flexible as much as you would want to put into it. We've been talking to Wendy about getting the word out as well about the Benefits Enrollment Center. So, you know, if you think you might be interested, give me a call or, you know, reach out via email, and I'd be happy to connect you with that group.
Okay. Somebody making a comment that, a lot of people there's some pride involved in, not being willing to ask for government assistance. And, there's for years been some stigma attached to that.
Yep, absolutely. That's probably the biggest barrier that we face, right? Is people just don't want to ask for that help. So I would encourage you to ask anyway, but
Well,
yeah.
one of the things we say, Pax, is to remind people that they've worked and paid taxes their whole life.
Mhm.
And this is just, taking things full circle.
Yep.
And that they've earned it and that they should take advantage and use it. So all of these concerns, sometimes we have answers we can give to help people move along this continuum.
Yeah.
And that's part of what the Benefits Enrollment Center and the volunteers who work there are going to help learn what these sort of answers are to some of the common questions like that.
Yeah.
You should see when you sit someone down to do a Benefits Enrollment Center checkup, there have been times that you can't even get the person to admit what their age is. I mean, not to talk about the more personal questions like income and this, that, and the other. It's just, tell me how old you are when you were born. And they go, no, I don't want to share that.
Yeah. It is. It's challenging, and they are sensitive questions that get asked, right? And people don't necessarily want to share, but we do the best we can, right? So, and just try and make people feel at ease that it's okay to share this information, that it's confidential, right? We're not gonna broadcast it anywhere, right? We're gonna keep it we're gonna keep it right where it is, right? And not share it with anyone else. So, yeah.
And for people on the call right now, one of the nice things about this is that it's an online screening tool. So you yourselves can go to benefitscheckup.org and just what it sounds like, benefits with an S, benefitscheckup.org, do a screening for yourself or make up a person.
Yep.
And see how it goes, what the questions are and the kind of information you get out of it.
Yep.
And you can think about sharing that with family, friends, people anywhere across the country, not just in Arlington.
That's right.
It's a really cool tool to use.
Yep. It's kind of fun to play with. So, and people are often amazed that there are, you would think, well, there's nothing that I qualify for. Well, you might actually be surprised. So yeah. Any other questions?
Yeah, you mentioned the senior farmers market program.
Yes.
Is that income based or is that?
That one is income based. Yes,
Okay.
it's 185% of federal poverty is the upper limit for income. So that program is a USDA program, and it is designed to get older adults, low-income older adults, access to fresh fruits and vegetables, because we know for many individuals who are low income, those are unaffordable. And I see a question from Connie Francis about advocating to the county board. Yes, please. Anything that you can do and any information that you need, let me know to support your ask. But yes, and I will tell you at the state level, there is going to be a concerted effort to advocate for additional funds for agencies on aging in the next General Assembly. So if you are interested in advocacy, if you would be willing to talk to our delegation, if you would be willing to testify at a committee meeting, we're always looking for individuals who are willing to do that type of thing. Or even, as a group, if you would be willing to collect stories on how aging programs help you remain in the community of your choice. Having those stories to be able to share really is helpful, because it puts a real puts a face to and a real lived experience to what it's like to be an older adult in the community. So those are all different ways that you could help us advocate. But if you're willing to do that and want more information on how you can be involved, let me know.
Okay, well, that brings us to 11 o'clock. What I'm going to close by reminding everybody that next week, our topic is local author Bert Solomon is going to be talking about his new book, The Murder of Andrew Johnson. And it's always fun to have local authors come on and talk about what they're doing. So hopefully we'll see everybody there. And with that, I want to thank Helen. This has been very informative. You've given us all a lot to think about and a lot of resources we can tap into. So it was very helpful.
Thank you for the opportunity. I really appreciate it.
Helen, I especially enjoyed hearing your background, which I didn't know. As many years as we've worked together, I didn't know you were a recovering IT person.
I am a recovering IT person.
So totally interesting.
Thank you.
Thank you for sharing.
Oh, absolutely. Absolutely. Everybody stay safe and cool, okay?
Bye-bye.
All right.
Bye.
Bye-bye.